In the medical setting, what this looks like is you have an expectation of a doctor to help you heal or to treat the disease that you have or the condition that you have. And not only can they not do that, but they also make you feel like you are the one who's wrong for having the symptoms in the first place. So you're just too anxious and, there's nothing on your test. So your migraines are just anxiety. Go see a therapist.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome to the Medical Trauma Support Podcast. Today, I have Destiny Davis with me, and she is a licensed professional counselor, a certified rehabilitation counselor. She has her own private practice in Atlanta, Georgia, and she is the founder of and host of the Chronic Illness Therapist Podcast. So welcome, Destiny.
Thanks, Sarah.
I'm glad you're here.
Yes.
We've connected before, and I'm really excited for you to be able to tell your story and talk about the work that you're doing and the things that you've done for yourself through your own journey that have been helpful so that the listeners and viewers can maybe get a few tips that they can use.
Yeah, definitely. So I grew up with both my parents had disabilities of different kinds. And so living in the world of kind of health and complex chronic health conditions, I just grew up in that and then watched my mom go through the system, never getting answers and never getting any help. And then eventually being labeled hypochondriac. And that's kind of what everyone knew her as. And that was what I grew up actually knowing her as. And as I got older and started to have my own health experiences, there was a lot there too. And I know we're going to talk about medical trauma today, which I'll just preface with medical trauma is not always what's done to you, but also maybe what you didn't get that you should have.
Mm-hmm.
And I know that I didn't get the medical care I needed because I was too scared. I was just scared that no one was going to listen to me. And the reality is that would have been true. That would have been true had I gone I think I did try at one point in my 20s, and the doctor was like, yeah, she did some labs and it was like, your labs came back normal. And I looked deflated, and she was like, you should be happy. And I was like, yeah, happy that but also what's wrong with me? Because I don't feel great. Right. So yeah, I think my story very much comes from lived experience. And then rehabilitation counselors, that's what I did my master's in, was rehabilitation counseling. And that field is about helping people with disabilities gain, maintain, or regain employment. So GVRA is a federal government agency that most people don't know about, but it is in every state. It's federally funded and it's free for anybody with a disability who's struggling to either keep their job or find a job that can accommodate their needs as somebody with a disability. And even just mental health conditions like depression will count as a disability to go and get services from GVRA.
Wow.
Yeah.
Thank you for sharing that. And I'll put a link to that in the show notes too, so people can access it easily.
Yeah. Yeah. So I learned a lot in my master's program about accommodations. And, that was really a new concept for me. For me, it was like you just push through and you just keep, you keep pushing. You don't ask for help. You don't try to, when I was at my sickest, I needed a shower chair. I couldn't even wash my hair. I couldn't put my hands above my head to wash my hair without debilitating fatigue in my arms and in my body, passing out almost in the shower, things like that. And so putting a chair in there was no, that's only allowed for 80-year-olds who have lost their mobility. And this is something
that's was that an internal message or? Yeah.
Yeah. That was an internal message, and it's internal, but it's also what society, I work with clients on this all the time.
Yeah.
How to bring accommodations into their life, whether that's seated canes or rollators or I've worked with clients around many mobility aids, and the narrative is always the same. I'm not sick enough to use this, or I'm too young, and what will people think? Or they actually do get pushback from people in their lives. And so Yeah, and all of that contributes to the trauma of having a medical condition. If we just accommodated, I mean, even think about even like, yeah, we have IEPs in schools, but for kids with ADHD and for with autism and all of the different mental health conditions, which is great, but do you know how much paperwork is required to get those accommodations in place when people are already struggling mentally and or physically, and the level of paperwork that's needed is astronomical. And I can't tell you how many stories I've heard of people just going through school without accommodations because they actually felt like they didn't need them because of how hard it was to get the accommodations. Like, oh, this must be for people who are just really, really sick, like the worst of the worst. And it's like accommodations are meant to equalize the playing field for everyone.
Yeah.
So,
Beyond just the paperwork, there's also like the meetings that you have and then the advocating that you have to do on top of it, because, the the teachers in the public school system, they already have so much on them. I mean, and administration. It's a really hard system, but they don't always have the time and the capacity to be aware of all the different IEPs that are in each
yeah.
one of their different classes that they're doing. So it really is, it's very challenging. And I think a big part of it too, like you said, that was an internal message, but it was placed there because we do live in a society that tends to be like, nope, dust yourself off, pick yourself up and go. It's not very humane to treat people that way, but it is like this message in the society that we've grown up in the US.
Yeah, and the saddest part about it is that it doesn't even have to be as difficult as it is. Like when you think about it, like, yeah, how is a teacher supposed to keep up with 10 different accommodations? Well, if you allow for a dynamic classroom where kids are just simply allowed to sit on the floor if they need to sit on the floor because that helps them pay attention better, then you don't have to consider who has which accommodations and who you're allowed to do what. And then how do you explain that to the kids that don't have disability, but now they want to sit on the floor? Just let them.
Right.
It's frustrating that the
Well,
system.
yeah, I agree, because it also is like, even if somebody doesn't have a disability or a designated disability, everybody has a nervous system
Yeah.
that can get dysregulated. You can get some sympathetic charge. Sitting on the ground, being able to move your body is part of that process. It is like part of being human. So there may be somebody who doesn't actually need an IEP, but maybe they saw something really scary that morning on the way to school and it feels really good just to sit on the floor, and they may not even realize they're really just grounding themselves. And so yeah, I love that. I think about this often around neurodiversity and how we wouldn't be alive as a species without neurodiversity.
Hmm.
Like, it's part of why we're here today. It's part of how we solve complex puzzles and try to figure out how to heal our country, right? How to heal our climate. Like, we need all of these different kind of brains. And I believe the reason that it is so challenging is because we have built a society around this one type of brain that we decided to call the normal brain. But we've always had neurodiversity. Always. Like, I think, I talk with my kids about Einstein, who is dyslexic and gifted and all the things. He was a neurodivergent person.
Exactly. I
And
know.
so, yeah, I agree with you 100% just about like, we could have, we could create a culture and a society that is more open to the diversity and all these different spectrums. It's a
Yeah.
challenging system for sure. You were also, talking about some of the medical trauma that you'd experienced in your, history journey with chronic illness. And I was wondering if you would talk a little bit about that.
Yeah, and I think it's important to talk about like the systems at play as we talk about kind of the specific medical trauma, because the
Yeah.
again, especially when you're talking about trauma that not necessarily like happened to you, like a surgery gone wrong or a medication that caused a permanent side effect damage. Those are easy to pinpoint, like, oh, that's a traumatic incident. But the trauma that I more so talk about with have reflected on a lot in my own life and with a lot of clients as well is what should have happened to you, and that starts as early as the school system. You should have been taught how to say yes when you want to say yes and say no when you want to say no. And so going into kind of finally trying to get my own medical help, it took a lot of money, it took a lot of time. And I'm trying to decide where to go as far as like talking about alternative and complementary medicine and traditional. That was all part of my journey. It was like, I didn't trust Western medicine because of how it had treated my mom growing up. And
Right.
then I was having a lot of the same symptoms that I watched her have growing up. And so it was like, if they treated her that way, why would they not, treat me that way?
Right.
So that led me down a path of alternative medicine, chiropractic, supplements, trying to cure everything with diet. And I think I learned a lot from some of the, like, I think what alternative medicine does for you is it does teach you a little bit about what's within your control and how you're not powerless to a disease or a condition. But it puts too much emphasis on that. Like, if you just do the right thing, then you'll be cured. Whereas Western medicine kind of says, almost, they actually don't say this, but the overarching message that comes across is like, we have the pills and the surgeries to fix you and you are powerless, and and then if we can't fix you, then no one can, kind of thing. And so
Yes, I've experienced that in both, but I also have had such vast experiences within each system because, like you, I have also tried some what would be called alternative or holistic, when actually the ideal thing is to welcome the entire spectrum of resources available to us and find out what is best for us. But I've also within Western medicine had the range of experiences too, where I've had just phenomenal practitioners that have sat with me for an hour. They've done the shared
yeah,
decision making. It's been wonderful, and it's also been really healing for some of the experiences I had where that wasn't the case. So
yeah,
yeah. And we talk about kind of like the messaging that we get too. And I think that messaging, like the messaging of like Western medicine is this way, alternative medicine is this way, is so harmful because
it
then
is.
it keeps people from trying the things that could be like their unique
Yeah,
ratio or whatever, right? And
exactly.
with medical trauma, I think something that's so hard for people, and this may have been your experience too, is when they've had a bad experience, they're afraid to step back into it. Actually, it is your experience, you said, with your mom. So you witnessed that experience and you're like,
Exactly.
no.
Yeah,
And that's so hard because there are actually some phenomenal providers
yeah,
and you miss out on that level of care and miss out on actually maybe some healing happening because you step back into the system and you're treated so like kindly and help.
yeah. Yeah, I think, that's a big part of what I think I often work with people on, is how to step back into a system that might have harmed them.
Yes.
Because I hate the phrase, like, it's not all people, it's not all, I hate when people sometimes it's a cop out to be like, not all cops are bad, not all therapists are bad, not all teachers are bad. And it's like a cop out to get away from the harm that's done in that system. But
Mm-hmm.
at the same time, it is true. There's good and bad in every single profession.
Yes.
Chiropractors, medical doctors, acupuncturists, dietitians, therapists, like, there's going to be good and bad.
Yeah.
I think I used to see things through a whole system lens, like the whole system is bad, and that means you can't trust anyone in it, because if they're in it, then they're a paid shill, or they're, that was the rhetoric that I was steeped in, especially having gone to, my undergrad was at a chiropractic university, so I was there for nutrition and psych, but being around a bunch of chiropractors, the largest chiropractic university in the world. I mean, one of my good friends just told me today, like, they're having a CE, and like an anti-vax documentary maker is like the keynote speaker this weekend. So like, that's what, it's very, very, very anti-science. And that is a part of, again, part of the harm. On the other side, being like, well, if the science doesn't say it's completely bad, like, that's also harmful. Like,
Yeah, it
science.
invalidates people's experience, like true experiences in their body for anything to. That's, I think, one of like the biggest parts of medical trauma, right? Is regardless of who's saying it, when you have had an experience in your body and somebody says, sorry, the science doesn't show that.
Yeah.
It's
Yeah.
like, but,
Yeah.
but
I
no,
can
like,
tell you, I don't know why this happens so often with kidney patients. I can't tell you how many times I've heard a kidney patient say, I went to my urologist or even another doctor, and they said, that's not possible for me to feel pain in my kidneys there. And it's like, I have a kidney problem. I'm telling you exactly where I feel it. That's exactly where my kidneys are. Like,
yeah,
how your textbook might not say it, but I'm telling you what's happening here.
right.
So it's definitely real that people are just dismissed in sometimes the worst of ways and in sometimes the most subtle ways. The simple, like, oh, you're too young for this. Even if it's said with compassion, that phrase, like, it is the hardest thing to hear, because you're like, what does that mean? Does that mean I'm lying? Does that mean you kind of believe my experience, but you don't really believe that anything's wrong with me? Does it mean I'm only going to get worse from here? Like, I'm not even going to see 80, because if my body already feels and looks like an 80-year-old, then I won't get there. Like, there's so many, it's so harmful. These,
Yeah. Well, I can imagine also it would feel like you're the only one.
yeah, yeah,
If it's like you're too young for this, you think, oh my gosh, I'm the only person my age that is struggling with this.
exactly.
Yeah.
So it's really, again, it's about, sometimes it's about what's done to you, but also what's not given to you. And that's where I think the therapy part comes in, is we need to be able to just verbally dump for an hour before we even understand. Then, especially if you're a verbal processor, by the end of an hour, you might have just started to recognize what the problem is after talking about it for an hour. Your doctor can give you that. And honestly, even in functional medicine, where the appointments tend to be an hour, I find even then, like, sometimes it's still a bit kind of, okay, well, our hour's up and I still don't have enough information, or I haven't given you enough information yet, because I don't know the right information. I'm the one who's sick, and my expertise is simply what I'm feeling, but it's not the pathology of symptoms. That's what the doctor's
Yeah.
job is. And so, I think I talk a lot with clients about being succinct and specific and concise in their appointments with their doctors, so that their doctors can help them better. But what happens when you don't have that space to do that? Now you go into your doctor's appointment, you're trying to verbally process, and they're kind of annoyed with you because maybe you're talking about emotions, or maybe you're talking about this pain in your leg, but you're here for the thing in your arm. But to you, it's all connected because it's your one body.
Yeah, and I'm a huge advocate for therapy and for people getting that support, but it isn't accessible to everyone. So I think if there's somebody listening who is not able to get that kind of care, another way that they can do that is to write it all out. And the first time you're writing it out, you're not writing it for anyone else. You are like getting it out. Like you said, you're processing. If you're a verbal processor, you may talk it out and
Yeah.
but you're getting it all out. And then after you've been able to do that, you can then put it into like maybe a 1-page document that you bring to your medical provider, and you're like, here's what's happening, here's my history, whatever it is. It's kind of part of that preparation for an appointment. Like that's part of it. There's also emotional preparation that you'd want to do for an appointment. And one little thing I want to say about that is, especially for somebody who's never written down their story or haven't had the opportunity to process it, it can bring up some big emotions, feelings. And so it may be that if you're doing it for the first time, you want to just do little bites of it, little bit at a time, so you don't, overwhelm yourself. But Destiny, I'm a huge fan of therapy. And so
Yeah.
I love that you're doing that with people and being a space for them to kind of process it so they get really clear on what they bring into their next appointment.
Yeah. Yeah. I think we just need more time. I think that's a part of the trauma too. It's just, there's just not enough time in this
Yeah.
world that we live in. Everything is very rushed, whether that's in the school system or in a medical appointment or in your own life where you're working 9 to 5, then you're trying to get dinner on the table, and maybe bathe the kids and brush their teeth and do all the things that are needed to just like survive and make it to the next day. So
Right.
having the time and the luxury to sit and reflect, it is a luxury, I think.
Yeah.
And I think it's important to name that. It doesn't mean it's impossible to do it if you don't have that luxury of time. But if it's hard, just know that it's not because you're not trying hard enough or you're not
Right.
working hard enough. It's because the system is not set up for it.
Yeah. Yeah, definitely. And you also talked, or we talked about some of the attachment trauma that can happen in with the journey of chronic illness and in the medical system, but also maybe outside of the medical system. And I think you talk a lot about the attachment to your own body and this work.
Yes. Yeah, exactly. Attachment trauma is anything that kind of ruptures. Well, let's define trauma. Trauma is anything that happens too much, too fast for your nervous system to absorb and like process. And then attachment trauma is anything that is kind of traumatically ruptures either how you feel about yourself and as a person, or an attachment trauma can be when you really have expectations of a parent to care for you in a certain way and they simply don't, either because they can't or decide not to. There's a traumatic rupture there because our parents are the people that birthed us, and they're the ones that are supposed to care for us in a certain way. So it usually comes back to parenthood, but it can also come having a nanny for 16 years, and then all of a sudden they go back to their own family and now they're no longer a part of your life. That can be an attachment trauma. And so in the medical setting, what this looks like is you have an expectation of a doctor to help you heal or to treat the disease that you have or the condition that you have. And not only can they not do that, but they also make you feel like you are the one who's wrong for having the symptoms in the first place. So you're just too anxious and there's nothing on your chest, so your migraines are just anxiety, go see a therapist. And that is something that people hear. And so there's a rupture in the relationship between you and the medical system. I came to you for help and support. You said you could help and support me. That's the overarching, right? The medical setting says you're sick, come to me. And then you go to the medical setting and they say you're not sick, you're anxious, or you are sick, but we still can't help you and we don't know what to do with you. So it gives you this bit of like a sense of instability in maybe not only who you are, but also who you can go to, who is safe to go to. I know that was definitely my experience. Like if I already had this preconceived notion that Western medicine was unsafe to go to, I go into holistic medicine and they also provided lots of good things that I learned from, as well as some harm. It's very confusing. And so there's a lot of attachment work around understanding who you are. You're getting, really building up your sense of self. What do I believe and what do I think? And being able to hold nuance and hold multiple truths at once, which a lot of us just weren't taught how to do.
Right. Yeah. We're seeing that play out big time right now.
Yeah, exactly.
Yes, being able to hold both. And it even takes me back to what we started this conversation with, is that within any system that you step into, there are going to be places where you can find safety and support and places where you can't. There are going to be people that are safe and people that aren't. And yeah, that nuance is challenging. And I think it's, when we're children, when a lot of the attachment work is happening, we can't hold nuance like that. It's life is more black or white when you're a kid. And yeah, a lot of us aren't taught that as we age, or we aren't given opportunities to see that, or we're taught that by an adult who also didn't get opportunity for their brain to fully grow up and learn nuance. And like, actually, that to me is so layered, because I'm just thinking about experiencing a medical trauma. We know that medical trauma, the experiences are so varied and like such a huge range of things that happen that feel traumatic in the medical system. But it's just like, okay, so this thing happened. Even if I'm going into a totally different medical office or a totally different hospital, it's hard. Even if my brain can handle that nuance, my nervous system is really having a hard time handling that nuance. And it still feels like danger, danger, danger. So this is such an interesting layered area.
Yeah. In attachment theory, we talk a lot about repair after rupture.
Mhm.
And so that's kind of another piece that, yes, this is still kind of in that cognitive world, but I think it also, the cognitive and the mind and the body are completely connected. So
Yeah.
sometimes you need to do some of that more somatic bottom up processing to help you kind of, I guess the way that I see bottom up processing is that we have these experiences that are out of our control. Like a medical trauma creates this sense of tension and tightness and maybe panic as well. And you can't really control yet that that's going to happen until you actually allow yourself to feel the thing that's happening with resource. So a
Right.
lot of times people will get really caught up about like therapists saying, you need to feel it to heal it. And that's, I think, because they haven't been given the tools around feeling it yet. It's like they've just been told to like go into the dark, deep hole.
Oh
Well,
gosh. Without the nervous system capacity, this is like a huge, huge thing for me is like, you don't just expect somebody to just sit in this trauma and by themselves. No, it's a slow process of building the nervous system capacity to be able to sit with these things that, like we talked about earlier, overwhelmed your nervous system and overwhelmed your capacity, went way outside of your window of tolerance.
yeah, exactly.
There's a there's a reason it's a trauma, right? It was too big, it was too fast. And then to think that somebody's going to sit with that all at once without having increased that capacity and without having a person too to be with, which is, I know, it's a big part of therapy, is like you're revisiting these things, but you're like revisiting them in small pieces with a person who is totally attuned,
Yeah,
right? Whereas
exactly.
that's not usually the experience with trauma.
Yeah, exactly. I think that might be too, where sometimes people will, I'll see people like write online, like comments about negative experiences with therapy. Like, oh, I just went and talked and that was all I did for like X amount of weeks or months and nothing ever happened. And that could happen for sure if it's not a great match. There's a couple different things. One, something might be happening, but it might not be enough. Like especially if you're a perfectionist or you feel like a lot needs to happen at once, you might feel like nothing's happening because you haven't had this big, huge epiphany. But really, this work is so slow and titrated. And every time that you show up to session with a lot of tension and anxiety about things in the world that are going wrong or in your body that's going wrong, and the therapist sits there and doesn't judge you, that's a reparative experience.
Yeah.
And sometimes that's all our nervous system can handle. So that's one thing. Or simply, they're not attuning to you and your needs appropriately. They might be the most compassionate therapist in the world, but if you need like compassion plus guidance, otherwise you feel like you're more lost at the end of every session, then you need a therapist that's a little bit more directive. And some therapists are not directive at all. And then some are too directive. They don't give enough of it really is a personality match that you
Yeah.
have to find. And it doesn't have to be a perfect right fit match, but it needs to be good enough. Just like with
Yes.
all other attachment work, parenting needs to be good enough, not perfect.
Yeah.
Um,
Because there's no such thing as perfect. That's what I tell my kids all the time.
yeah,
No such thing as
exactly.
perfect. You're just going to hurt yourself if you're trying to go for perfect.
Yeah,
I'm wondering too, because you shared you have both lived experience and obviously education and experience as a therapist. I'm curious, what are some of the things that you used for yourself? Because you've already let us know a little bit that it's been a journey
yeah.
with changing belief systems even. And so what are some of the things that you use today, or some of the things that you've used in your journey that were really impactful?
Yeah, there's so many. I'm going to try to. There's one pivotal moment for me. This may not be your pivotal moment, like for those of you listening, and bear with me because it is a journaling prompt. And I know that every therapist loves. I actually don't prescribe a lot of journaling, but there was one day where I was just feeling so down and out. And I was like, am I ever going to get out of this? And I don't know if I found the journal prompt or if I came up with it myself. I can't remember. But the prompt was, you could have like what is your perfect day, not a vacation day or something like totally out there, but like your perfect day to day, what would life look like? And for me it was like literally like a slow wake up and like taking my dog for a walk. This was pre-kids, and it was just slow. It was slow. It was everything when I reflected on what I had written, that was the thing that kept coming back to me. It was like, I'm looking for slowness. I'm someone with a very fast nervous system, very like, I like to move fast, I like to talk fast, I like to think fast. And so I was starting to realize at that point that slowness could actually be safe. Whereas before, slowness was always very dangerous.
Yeah.
And I had to run from it. So there was a lot, obviously, that had happened before I had gotten to this point. But I think being able to like slow down and reflect on what your needs are I'm always going to come back to that. What are your needs? Because they change throughout life and they change from situation to situation. A lot of us struggle with naming our needs either because we feel like we're not allowed to, or we feel like what our needs are out of the reach of possibility. And so what I would say with some kind of journaling prompt like that is that the purpose of the journal is that you do allow yourself to go beyond what's possible. When you do that, then you can kind of reverse engineer and see like if I went to like level 10 fantasy land, if I bring it down to what does level 9 fantasy look like? What is level 8, level 7? Then I can kind of see like, oh, level 6 actually isn't fantasy. That's like, that's attainable. I can do that.
Yeah.
So for me, it was slowness, a lot of walks, all of the different therapy techniques, things like parts work and breath work and guided visualization meditation. So not the kind where you try to like get everything out of your head, but where like something like a body scan or progressive muscle relaxation. PMR was pivotal in my ability to start sleeping. I think it's important to note that everything I'm mentioning is not profound. It's stuff that's actually been around for a long time. And sometimes it can feel like it's too simple to work, but I think that's why I started with the conversation with slowing down.
Yeah.
If you're trying to use PMR and then like go do a HIIT workout and then go to work and then like come home and meal prep for the week, like it has to be a slowed down process where you give yourself time and space to actually learn from whatever you're doing.
Mm-hmm.
So, yeah.
Yeah. I have also used everything you've talked about as well as part of my journey. And one of the beautiful things about that too is that it's free.
Yeah, exactly.
Right? Slowing down, going for walks. Insight Timer is a free app that I use every single day. And it's what you shared sounds very similar to my life, is like finally learning to slow down. And when I was younger, I ran, I played soccer, I did all the fast things, and I thought, there is no way I will ever do yoga because I don't ever want to sit in the stillness.
Totally.
And
Yep.
I became a yoga teacher a few years ago. So
Yes.
yeah,
And I
that's
actually have a couple meditations on Insight Timer. So
oh my gosh, how
yeah,
wonderful. I'll link to some of your meditations in the show notes. That's wonderful.
Yeah, I'm trying to put it into a 7-day course, but it's not quite there yet.
Well, got a lot of other cool things you're doing right now, which actually leads me to like a couple of the questions I like to end every episode with. One of them is really, and I feel like it kind of ties into what you just said, but is there like one piece of information that you think it's important to leave the listeners with?
Yeah, really pay attention to what your yeses are and to what your nos are. Even if you can't like act on it, like if you can't actually say yes to the things you want or say no to the things that you want yet, just at least be aware of it. Don't push it out of your mind simply because it's not attainable yet. I think that is probably one of my biggest pieces of advice.
Yeah, that's beautiful. And then finally, how can people find you? How can they work with you?
Yeah, so I do offer therapy intensives for people in the states of Florida, Georgia, and Colorado. So that's either 1 to 3 days of full on like therapy for 3 to 4 hours a day. And that's one way to work with me. Another way is through a low cost membership that I have. It's not therapy, it's support. And that can be found at thechronicillnesstherapist.com/membership. For other therapists that might be listening to this, I do have free consultation groups, so business group and a clinical consultation group. And then back to non-therapists, I do have monthly workshops that I do for people who have chronic pain and chronic illness. And the workshops range like from relationship stuff to this month we're doing September 2025, we're doing kind of like how to build like a safe sensory like space in your home. Just really giving your home like a sanctuary. I hate using some of those like more
Yeah.
like out there kind of words, but that, I mean, I'm really, that was a part of my healing journey too. It was like, you have to make your home a place that you want to be. If you're
Yeah.
constantly trying to run from your home and run from work and run from the world, like you need a safe place to come home to. So
Yeah, especially if you do want to start slowing down, you need to feel safe in a space to slow down.
yeah.
That's really beautiful. Thank you so much for
Yeah.
being on. It was so
Thank
good
you.
to talk to you.
Thanks, Sarah.
I hope you enjoyed this medical trauma support episode. I wanted to let you know that if you are looking for support as you're healing from medical trauma, you can join our membership community. It is called the Befriend Your Body community, and you can find out more at medicaltraumasupport.com.